My topic is use of combined oral contraceptive pills and consequences. Definition. The combined oral contraceptive pill, COCP, often referred to as the birth control pills or colloquially as the pill, is a method of birth control which includes a combination of an estrogen and a progestin.
LH, generated in the pituitary gland and the hypothalamus in the brain. So preventing ovulation, or you could say, is to just say the words mimic pregnant. But let's take them one by one. The minimum you need to know is in three. So the oral contraceptive changes the release of hormones. Specifically, the hormones are FSH, which is follicle-stimulating hormone, or the luteinizing hormone, LH, generated in the pituitary gland and the hypothalamus in the brain. So preventing ovulation, or you...
Application. Inhibit fertility. Application. The pill causes change in cervical mucus that impedes the natural movement of the sperm. This all serves to shoot out the bacteria that can cause infection.
From the man's sperm. It contained only synthetic estrogen, and it worked by making a woman's body think she's already pregnant. That is, a woman naturally produces higher levels of estrogen when she's pregnant, and this prevents ovulation, or the release of an egg. However, the high levels of synthetic estrogen in the pill from the 1960s and 70s caused dangerous side effects. After many women began to suffer blood clots, heart attacks, and strokes, the pill manufacturers lowered the levels of estrogen from an initial 150 micrograms per pill to today's dosage of 30 to 20 micrograms. While this reduced the rates of side effects, it increased the rates of unintended breakthrough ovulations. In response, pill manufacturers added synthetic progesterone to the synthetic estrogen. The progesterone has two effects. First, it thickens a woman's cervical mucus to impede the movement of sperm en route to the egg. Second, the progesterone dries up blood vessels along the uterine wall.
Pros. Reduce premenstrual cramp, as can be inflammation of the womb or abdomen, and breast pain. Prevents iron deficiency anemia. You can reduce the risk of uterine cancer and ovarian cancer, the risk of ovarian cysts, fibroids, endometriosis, pelvic disease. Cons. Requires regular medical control. It can cause weight gain. Doesn't protect against STDs.
21, this is what's called a monophasic pill, which means there's 21 of one dose of pill. This is a combination of estrogen and progesterone. And then there's these pink pills, which are just sugar pills. There's no medicine in this whatsoever. And so you start here and you take one every day. And then when you get to here, you throw this out and you open up a new pack and start a new pack. The truth is, if you didn't take these pink pills and you just took nothing that week, you'd be fine. The problem is, then you get out of the habit of taking a pill every day. And so that's why they're generally packaged this way. Now they also have what's called triphasic pills, where each row will be a different color. And they have pills where they don't have 7 placebos, maybe they only have 4.
Disease. The hormones in the pill have also been used to treat other medical conditions, such as polycystic ovary syndrome, PCOS, endometriosis, amenorrhea, menstrual cramp, adenomyosis, menorrhagia, excessive menstrual bleeding, anemia related to menstrual and dysmenorrhea, menstrual pain.
Each year. As its name indicates, uterine cancer forms in the tissues of the uterus. 2 types of uterine cancer are endometrial cancer, which starts in the cells lining the uterus, and uterine sarcoma, which is a rare cancer that begins in muscle or other tissues in the uterus. From where it begins in the lining of the uterus, uterine cancer can eventually invade the wall of the uterus and may also invade the cervix. Over time, it can grow through the wall of the uterus into the surrounding tissues, the bladder and the rectum. In some cases, uterine cancer can also be spread by the lymphatic system to the vagina.
Amenorrhea. Amenorrhea or amenorrhea is the absence of menstrual period in a woman of reproductive age. Primary amenorrhea, menstruation cycle never starting, may be caused by developmental problems, such as the congenital abscessing of the uterus, failures of the ovary to receive or maintain egg cells, and genetic disease.
Hello, my name is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. In this video, we'll talk about amenorrhea. Amenorrhea is defined as the absence of menstrual bleeding. In primary amenorrhea is the absence of menstrual bleeding and secondary sexual characteristics in a girl. In this diagram, the different causes of amenorrhea, primary amenorrhea, are described. The graph shows the distribution of the different causes of secondary amenorrhea.
Polycystic ovary syndrome. Polycystic ovary syndrome, PCOS, also called hyperandrogenic anovulation (HF4 Stein-Leventhal syndrome), is one of the most common endocrine disorders among females. PCOS has a diverse range of causes understood, but there is strong evidence largely that it is a genetic disease.
Also called PCOS, is an imbalance of the female sex hormones. The ovaries are part of the female reproductive system, along with the fallopian tubes, uterus, and vagina. Your ovaries contain your lifetime supply of eggs. These eggs are immature and are stored in tiny, fluid-filled structures called follicles of your ovaries. Each month, the pituitary gland secretes follicle-stimulating hormone, or F. Immature eggs start to mature. expanding the size of.
Thank you very much.